A steady procession of hearses bring the latest virus victims to the temporary morgue set up in Madrid's largest ice rink. On Sunday, Spain recorded another daily death toll of more than 830 people. Such a small increase on the previous day is seen as a glimmer of hope, but the situation remains critical.
It is very likely that the outbreak is evolving properly, thanks to everyone's efforts. Having nearly 20% of our cases recovering is an encouraging statistic. But it is true that the number of people going into intensive care units is still increasing, and there are many regions operating at maximum capacity and many other regions quickly getting closer to this limit.
The UK has recorded its second successive day of more than 200 new deaths, and the government has put the entire country on emergency footing, unprecedented in peacetime. Asked about the timescale for the current restrictions, the answer came it could be many months.
So I think 3 weeks for review, 2 or 3 months to see whether we've really squashed it, but about 3 to 6 months ideally, and lots of uncertainty in that, but then to see at which point we can actually get back to normal. And it is plausible that it could go further than that.
There's been criticism and controversy over the limited scale of the UK's testing regime, but there is evidence that capacity is slowly increasing. This drive-through test centre in the car park of an animal adventure park at Chessington has opened specifically for National Health Service workers. The Royal College of Nursing, Britain's largest nursing union, estimates that up to 20% of the UK's healthcare workforce is currently at home self-isolating. These testing centres will bring certainty, allowing potentially hundreds of nurses to return to the front line of nursing at a time when the healthcare system needs them most. In France, overwhelming pressure on congested hospitals in some regions has made it necessary to transfer patients to other areas. These patients are being taken by train from the Grand Est region to New Aquitaine. And some French patients are being transferred to Germany for treatment by a combination of German military plane and French military helicopter.
We need to free up some space. When you free up a space, it gives you room for a new patient. And that saves a life, so there won't be a gridlock on hospital resources.
Across Europe, coronavirus restrictions have left the streets almost empty. But the grim prediction is that it will get worse before it gets any better. Paul Brennan, Al Jazeera.